Abler, whenever you're ready, Mr. Chairman.
Oh, I do just have a couple of reactions, and then members had questions, and some of them can be answered by staff, and I'll answer what I can, and Senator Benson, I think, is going to come back when she gets finished. Anyway, so just intention-wise, that NPI number, Fraser, I think, had the concern, that number, we didn't mean to have that in the draft either, because that was, I never liked that in the first place. I do have a list of who's not getting reduced in the rate cut thing. So it does not include inpatient or outpatient hospital, does not include mental health services, does not include dental, does not include prescription drugs, does not include medical transportation, managed care elderly waiver payments, or the CD treatment fund. So those are out of that. And then I want to explain something else. And I've been here 18 years, and it's an honor and a real challenge to be in this position, and anybody who's been close to it knows that. And this is certainly a process, and in this bill we attempted to set out some priorities. The people with disabilities, the frail elderly, and kids in a number of ways, sex trafficked kids, kids with mental illness, kids that, anyway, that's been the effort to have those priorities be expressed. And there are gaps, as I'm fully aware, and no testifier surprised me with their comments, except my disappointment in not being able to do everything I wish I could do with my part, and then Senator Benson made her work on her half. And so this is a process. And so what we attempted to bring forward was a balanced bill that, based on choices and funding sources that people maybe didn't find desirable, but at least that it met the budget rules and it balanced. I had a draft of the House version, which is out now, and people will consider ours to be at least the tight version of that. And in terms of one item I just wanted to point out, on the 4% campaign, it's on my mind. We had, all along I had an increase penciled into every spreadsheet until Saturday, I think it was, when at the final fiscal note, the department said that the $30 million, $120 million item had to be addressed in that increase. And so whatever number I came up with, and I won't burden you with that number, although you're probably curious, it would have cost $150 million more to pay for a penny of an increase, because they made us address this management budget assumption. And I would like to help people understand that this is not a small matter. The governor, I believe, is not going to be paying for that. There was a clear language, in my opinion, that paid for an increase in the DWRS area, amounting to, I think, $30 and $120 million over the two periods. And in an unprecedented manner, they ignored the plain language at MMB and did not put it in the forecast. And so putting us in the unenviable position that if we point it out, and you have to either, if you don't do it, you don't get any credit for not doing it. It just goes away. And if you do it as the plain language calls for, we're charged the $150 million. And so it's my position that it ought to go forward. What that does, however, is create a hole in the tails and in the November forecast. So it is a really hard problem, but I was kind of happy it was sort of ignored for the moment. But then when this PCA increase came forward, the department chose in their fiscal noting wisdom to add $150 million onto that, which made it just untenable. So it's still in my mind. There's still something to go forward, but I just wanted people to explain. Senator Laurie knows how things pop up at the end. You're like, good to go, and then like, what, 40 million more? Oh no. 150 million more is like, that was, we had surprises along the way. That was probably the singular worst surprise. So anyway, with that, I'll stand for questions I can answer. I know Senator Laurie asked for a listing of policy provisions in the bill. Maybe we could start with that, if that would be a leftover question. And between, I don't know if Mr. Monahan and Ms. White is she at the, oh yeah, so Mr. Monahan, if you want to come sit in my chair if you want, and just so you can be here and ask questions. And so maybe Senator Laurie, if you want to ask your question, and then I'll yield to the chair to do what she does.
Thank you, Senator.
Thank you, Senator Abler.
Senator Laurie, and then I'll have Senator Klein.
Well, actually, I was wondering when we were going to step through the policy provisions that are in here, just so that it's on the record while there's still a pretty good, group assembled. It would be really helpful, I think, for the public process. And then another one of my questions, I think, was answered. So the issue with there being 30 million in 18-19 and 120 million in 2021 that will occur, that will be spent on home and community-based providers if we do nothing. We did nothing, right, in this bill?
Senator Laurie and Senator Abler,
Thank you.
Do you want policy to be stepped through before you have a discussion, or do you want to answer?
No, I think, this is part of the discussion, so I think it's a very legitimate question, and so we'll just take the questions that come. I've got all day, so this is what I'm here for. And so, Senator Laurie, to your question, this bill does nothing to address that, which in my opinion sends the money forward, but which creates a $30 million issue for at least for the November forecast. So we
Senator
are silent,
Laurie?
which means this bill supports that money going forward.
Senator Laurie.
Madam Chair, thank you. And so, I haven't really tracked the global budget targets closely yet, but did the majorities leave money on the bottom line, accommodating the fact that we didn't, that you're not going to change it, and so there's this extra $150 million that's known to be committed?
Yeah.
You were on notice, we talked about it
Right.
earlier a few times. You should make sure it's accommodated in some way in our fiscal tracking as we move forward. Otherwise, add to that $625 million shifted into the next biennium, another $150 million. I mean, we're talking real dollars here at this point. I mean, this is beginning to look like kind of a fiscal disaster. I mean, some happy people out there, but kind of a real fiscal disaster on our books.
Thank you.
Senator Abler.
Senator Kiffmeyer, Senator Laurie, there's some other person who's a national figure who uses that word a lot, so just be careful. We'll be having a hard time separating you too. Sorry, that was just a bad joke. So I don't consider this bill to be a disaster. I consider it to be it's a thoughtful representation of the priorities that we have. And I do know that I believe there's at least $30 million on the bottom line of miscellaneous in our targets. I do not know what the tails are for 2021. And when Senator Rosen comes back, we could ask her to comment on those tails and what they're planning to do about that. I do, and just to be very frank about it, this topic will certainly be part of the last negotiations. And I'm cheering for this committee's side to win so that money can stay on our side. So that's all I got on that. So.
Okay, thank you, Senator Abler. Senator Klein.
Thank you, Madam Chair. Thank you, Senator Abler. So I just wanted to go through something that came up in conversation earlier with you and Senator Hayden, Senator Lurie, so that I, as a new member, first approach to these omnibus spreadsheets, understand the language, and so that we are all speaking the same language about what a cut is, Senator Abler, to inpatient care. And when I look at page 21 of the spreadsheet, line 716, there's numbers in parentheses, and you call it a delay to inpatient hospital rebasing, but Senator Lurie's been kind enough to talk me through what numbers in parentheses mean, and my understanding is that means less than forecast. We're going to keep $15 million over the biennium in state coffers that otherwise would have gone to hospitals. And I think it should be agreed upon whether that's a cut or not, and instruct me, I guess.
Well,
Senator Abler.
And so actually the bill has two examples of either case. The rebasing is based upon a forecast increase that would go forward. And what we did was freeze the number at current. And so we spend no end of energy describing that as whatever we want to call it. But in my parlance, it's flat spending. And so if something is the same as it was, it's not a cut. But it is going to defy someone's expectation of what they thought they were going to get. And so off of their expectation, you could call it that. There is a rate cut in the bill of 2.3% that we discussed, where it's less than what it was. And that, in my opinion, is a cut. The entire budget goes up $2.2 billion or something off of the base. And so people gyrate either way as to what a cut is and what a not a cut is. So in my opinion, the hospital rebasing is just foregoing of an increase, and I would not call that a cut. The rates that we did 2.3% reductions on are, yes, that's a cut. That's my clarification.
Thank you, Senator Abler. Senator Hoffman.
Thank you, Madam Chair. And Senator Abler, thank you for, when you look at the overall bill itself, I think people should take note that it was, at least for your committee, it was done in a bipartisan manner that was pretty thoughtful. It's just unfortunate that at the end of the day, that thoughtful and wonderful experience is still bucking up against a system that wants to give tax breaks to those at the top of the ticket and forget about those at the bottom of the ticket. And I was really saddened by our inability to address the MA spend down provision that I still think is discriminatory to this day. And if there are any attorneys out there, it's something that I think, I'm trying to be funny, Jim, but that's what.
That wasn't really very funny.
It's just sad that
Senator Hoffman.
For years we've talked about MA spend down and just how it's just that not really fair. It's same thing with about marriage equality. Even people with disabilities cannot get married in the state of Minnesota without paying a penalty. Matter of fact, if they get married, they lose their benefits, and God forbid they even have to say they're not married. They can't be together. It's really sad. But I want to set that aside and just kind of talk about the next phase. I did raise a question earlier regarding the Department of Public Health. Specifically, what I saw as two provisions that might scratch up the ladder on our response to the federal issues that we need to do, specifically healthcare indicators, health indicators. And so I don't know if folks had a time to chime in on that or give me the list of those both on the preventive side and as the implementation side when it comes to Department of Health. And I was specifically looking at that Title V provisions that are in there and see where those cuts are. Did anybody have a chance to do that, Senator?
Senator Abler.
Thank you, Senator Kiffmeyer. The question came up, and actually, I had not paid attention to that particular nuance. It's in the other half of the bill where I didn't spend as much time, but it's a valid question. I don't know if any staff have an answer that they can give us yet, but I know that by tomorrow we can get something for sure.
Okay, Senator Hoffman,
Does staff know? Or?
Madam Chair, thank you. I'll stand aside and see if staff knows.
Okay. All right, Senator Isaacson
Madam
and then
Chair.
Senator Hayden.
Mr. Albrecht.
I'm sorry, Mr. Albrecht, sorry.
Madam Chair, Senator Abler, and Senator Hoffman, I thought that this list from the Department of Health had been handed out to members. Apparently it hasn't, so maybe someone could make copies.
Okay, we'll have that done. Senator Hoffman?
Thank you, Madam Chair. I just want to make sure I have time enough to take a look, because if we're touching, Madam Chair, on the 18 health indicators that we as a state, and those public health fines, those Title V public health grants, not just for one specific thing, but it moves a complete system of services around, and you would understand that with your background, so I don't need to preach to the crowd on that one. So with that, I'll hold off until later to have some more discussion, but I truly want to get that answered, and I just want to say thank you for the bipartisan effort in this work.
Okay, thank you, Senator Hoffman. We'll get some things around. And Senator Isaacson, I have you next.
Thank you, Madam Chair. So I came onto this committee a little later, and it's been a pretty steep learning curve, but I really appreciate that opportunity. And every day that I'm here, I begin to grasp the complexity a little more and more that we're struggling to kind of process our way through. And it's pretty amazing when you think about how many line items and how many little buckets we have to serve people, and how each one of those little line items, each one of those little buckets has an impact on some Minnesotans' life. And I think that's really important. What What I'm struck with, though, is that in all conversations I've had with people offline and all the conversations I've heard here and all the conversations I hear just around the Capitol, people seem to have a pretty good grasp of what the problem is when it comes to our health care. And yet we seem to be unable to or have the political will to solve that problem. If people get that we're paying for things in a really backwards way, often Band-Aids and cure-based approaches rather than preventative approaches that actually prevent future problems from happening, you know? And I look at, we kind of pretend and we talk about this bill kind of like it's in a vacuum, you know, and the very gracious people that came to testify today were very kind, frankly, much kinder than I think they should have been when they look at and appreciate what we've done, you know, what you've done with this bill and what you've got accomplished and what you're able to give. But the reality is that this bill doesn't exist in a vacuum. It exists with a bunch of other budget targets. And what I struggle with is I've heard you on several occasions, Senator Abeler, not you specifically, but you've said these are the priorities we've laid out with this bill, doing the best we can with what we have. And I don't doubt that you are doing the best, and I don't doubt that Senator Benson is also doing her best given the very limited resources that she has. But what I struggle with is a $900 million tax cut, a supposed budget of $1.6 billion, you know, and for me, if you want to talk about priorities, it's what we do, not what we say. And the reality is that I have not seen the tax bill. I don't know if anybody's seen the tax bill, right?
Senator Isaacson, we are on the Health and Human Services budget bill.
We are. I agree. And I'm tying these together because they don't exist in a vacuum, Madam Chair. The reality is money we're not going to spend on this target where we spend elsewhere. We're saying that's more important than what we have going on here. The money, then we give a tax relief to somebody else, says that that's more important than the 7,000 kids that are going to be homeless tonight. It's more important than the waiver system and the fact that we're not paying our employees that take care of disabled folks enough. There is a serious list of things we're saying those tax cuts or any place else we spend money are more important than this. And I would hope that the folks in this room that sat through the testimony that was tear-jerking and heart-wrenching over the last 2 months would maybe stand up and say that's just not going to work the way it is. And I get it, it's part of a process, and we all throw our best versions out, and we're going to come back and negotiate, but that's the second problem with this bill. That's the second problem, because the second problem is we're going to negotiate a bill that's going to go to conference committee, and in conference committee it's going to get worse. Because if you've seen our bill and you don't like it, you're going to hate the House bill. So it's only going to get worse, and then it's going to go to the governor's office, it's going to get vetoed. And then it's going to come back and be reworked. And when it gets reworked, it's going to go back to a conference committee. And now we have even less transparency and a smaller group making bigger decisions. And that drives me crazy. And while I'm trying to catch up and learn about all the waivers and the TANF funds and MFIP and all that stuff, and I'm doing the best I can, I think the bigger part of it is that sometimes it feels like this is just a little silly to sit here and posture like this when really we're going to pass a bill that we're not going to like. It's going to be worse when it gets to the House, and it's going to go to the governor and probably get vetoed. And that just is a struggle for me. Now, I don't believe that you're not earnest, Senator Abeler, but I struggle with what fundamental message we're sending about a very broken system. Thank you.
Madam Chair.
Thank you, Senator Isaacson. Senator Abeler.
And for all the things you just said, that's why I wanted to be a part of this committee. So I'm glad you're here.
Thank you, Senator Abeler. Senator Hayden.
Well, thank you, Madam Chair. And so it almost sounds like we're getting to this part where we're going to surmise the bill and tell you, kind of why we like it or don't like it. So before we get to that, I know Senator Lurie had talked about before. I do think it's important to walk through the policy provisions, and I know you do too, Senator. So, I know this isn't Congress, but I'd like to reserve the rights to comment on some of the problems or things that I think work well with the bill, but I'd really love for us to have a full context of what you're proposing. So if there's the ability for us, Madam Chair, Senator Abeler, for us to walk through the policy provisions in the bill that changes, I think that would be great.
Thank you, Senator Hayden.
Well, that'd be good. And I think actually
Abeler?
if I can rely on staff to kind of walk through, I have, we've been here for a little while, a number of years, and the staff continues to amaze me with that they remember all this stuff. And they point out, oh, this is mine. And so I think if there are versions at least that are largely policy, a lot of these are kind of interrelated and they're going to make a difference. but staff can at least help us with what they judge to be a policy question. I'll accept their judgment on going through the list, and maybe we can just start in the beginning and kind of walk our way through.
Okay, thank you, Senator Abler, but just 1 second, Senator Laurie, I had you next on the list. Is it to this point or something else?
Well, actually, if we had some sort of a handout that would help us track the policy, it would help a great deal. I mean, maybe it could come afterwards, but just...
Senator Laurie, I'll have
run through.
staff respond to that.
Senator Laurie, I mean, we got this request at 6 in the
No,
morning. So we have been trying to get a list together. It isn't finalized. We can give you it unfinalized if you want, but, you know, it's up to you. I mean, we certainly have a list that is pretty close to being finished, but...
Well, and I need to be
Senator
clear,
Laurie?
I'm not laying this at the feet of staff,
No,
who
I know,
I have a tremendous respect for as well. But this is an omnibus policy bill as well as an omnibus budget bill, and we don't have a listing of the policy in it. I mean, that's really a big problem.
Well, Senator Laurie, let's let staff go through some of it now.
Okay, so we're going to go through some of it.
Well, Senator Laurie, we're going to go
Without
through
any
it.
handouts.
have this?
You know, again, I'm not going to lay this at the feet of staff, but
Senator Laurie,
it's pretty
Senator
tough to
Abel?
operate
Well,
in this
Madam Chair,
environment.
I think there's this thing here. Oh, never mind.
So,
So
Madam Chair.
Senator Abler,
I'm good with whatever the committee wants, Madam Chair, and I don't want to put undue burden on staff, but it's mostly related to the money, and there's some, you know,
Madam Chair?
So, Madam Chair.
just a moment, please, both of you. Just a moment.
there will be a final list tomorrow, but Senator Laurie, the bill is mostly related to finance. That's why it's as small. It's kind of anemic when it comes to human service bills. But there's a few, like Senator Hoffman has a couple, like 2-paragraph things in here, and I think the most interesting bit of policy is the insurance article. That's probably the most one that any policy that's in here is like not objectionable, except for that insurance one probably, which you might have some. I know you had concerns about that, but in looking at what we put in here, that's related totally not to fiscal. It's on my part. I think there's nothing unusual or controversial, but it's that insurance part. That's what I got to offer you. But
So,
Thank you, Senator Abler. Senator Laurie, did you want to?
So, I mean, I
Senator-
guess I'll just sit and listen to whatever we have. Back to the point on cuts, though, before we move off of that entirely, that basic care cut, I do believe, does include services provided at Children's Hospital, the therapies provided at that hospital. One of the hospitals that sees, primarily disabled individuals and a really high percentage of medical assistance clients, and so
Senator Laurie,
they are
Senator Laurie.
therapies, not inpatient or outpatient, but coming back to that point.
Senator Abler?
well, just Senator Laurie, it was, Madam Chair, Senator Laurie, it was our instruction that it not include any hospital people, not inpatient, not outpatient, and not that list. I'm just telling you that's what our intention was with this going in, and so there was a fair amount of time spent one evening trying to actually, there was language and there was a spreadsheet number, and the language didn't match the spreadsheet, that was our intention, that it not include any. And so it's my belief that it does not, based upon everything we were told as we were working on this. So I'm just telling you what we intended, what we didn't intend. And if it does do that, then we'd better find out, but I'd be surprised that it would.
Okay, thank you, Senator Abler. Senator Hoffman?
Thank you, Madam Chair, and I went and got the answer to my question, Senator Abler. So, I know this didn't come through our committee; it went through the other committee. Now that we're combined, but I think it would be important. Under the Social Security Act, Title V was established to help look at, it was young babies and moms back then, and each state gets an allocation of federal dollars as long as they do programs that are going to benefit these health indicators that are established both federally and statewide, and that's what I just brought up. And so in this 7% base reduction impact that I got from the department here, and I'll share this this with folks, but there are clearly some programs that have some federal strings attached to it, Senator Abler. We want to make sure that we're talking with Senator Benson about, and I'll give just for example, when you look at birth defects information, child and teen checkups, children and youth with special health care needs, one of the things that was authorized 80 years ago under the Social Security Act, specifically Title V and Section 501, if you want to start there, it talks about that 1/3 of all services and 1/3 of your health indicators in the state must be geared toward youth, children and youth. They use the word special health care needs, but it's children and youth with disabilities. So, and then when we get the child and teen checkup, fetal alcohol syndrome, home visiting, those are all maternal child health. Those are all connected in there. So somebody from research needs to sit down to say, we just don't have a fiscal when we look at cutting or having a savings on the state, there's also a federal attachment to that might be more than what we anticipate. And so I would hope that somebody can answer that question. And I'll just be a real example for you on, like, for example, on if you look at the children and youth with special health care needs, even though the forecast is 320,000, the 7% base reduction is 22,000. Well, that just gets eliminated. Also, the federal dollar, it could be upwards of $100,000, and so each one would show that. And if you have 18 indicators of that, 18 times 100,000 is a lot of money. So I think we need to be, before we move forward on this discussion, somebody needs to flush out what, and not to say the other committee, whatever that committee, the Human Services Committee was doing, but, just, I want somebody to look at that, Senator Abler. Does that make sense?
And Senator
Thank
Hoffman,
you, Senator
in our
Hoffman.
committee, we do call it the
Senator
other committee.
Abler?
We don't refer to it as, like, we're not supposed to say that H word, it's the other committee. And I wish Senator Benson were here now, but I will take this up with her.
And Senator Abel, that's exactly it. Senator Benson is not here right now, but she will be going through this all with you, and to let you know that the entire language was posted last night. And so the staff did have to have a few hours of sleep, and so they're back here today, and they will be working hard to go through this and make those policy lists as you have requested. And so I think it's only appropriate to give them the time to do so, and it will be posted. One thing I would ask, as soon as the staff does have that ready, that you just send out a notice to the entire committee. I think it's pretty customary to do that, to let them know that that is the case. And my understanding is tomorrow morning at what time?
10.
Tomorrow? At 10 a.m. There, in this room, there will be a complete walkthrough of all of that with all those materials. And your questions, Senator Hoffman and others, Senator Hayden, I will call on you yet, that particular question they've taken note of, and so they'll deal with that as well, my understanding. Senator Hayden.
Good. Well, thank you, Madam Chair. I think that, and I appreciate the update that you just gave us. I think it begs the issue of why we're kind of rolling around in a circle, is that we need to have the information in a way that it's predictable. We need to have the information for us and the public that we know when it's coming. And I have personally felt uncomfortable all year long in the way in which we've been able to kind of present this. And that's with all due respect to you, Senator Abler, and the chairs. This process should be as such to where we know exactly what we're going to get and when we're going to get it. And if we don't have it, we should wait for it. I understand, and with all due respect to Chair Rosen and the work that she has to be able to do with the Finance Committee and us being able to be orderly, but it is important because we're asking questions that seem to be out of context, are questions that might have been answered if we had the information up front and was able to go through the process. I have a question on this issue of child care assistance, and we're going towards a federal conformity rate, and we're looking at upping the rate relative to market rate. But if there appears to be stuff in the policy bill that we haven't gone over, but it didn't show up in the spreadsheet. So that could be a good thing in getting providers more money, but a bad thing because we only have a set pot of money and we can increase and grow the waiting list. I don't know if that's exactly aligned. I think we'll find out here soon as we go through. I also think, Senator Abler, that let's not assume that things that seem to be agreed upon or maybe agreed upon with certain parties, that other people may not have issues with it, other members. There could be other members of the like, for instance, I know there seemed to be some widespread agreement on the child care assistance regulatory piece to cap it at 25 people. I think that the department felt like they had some widespread agreement on that in the community, and we have multiple community members show up today and contacted my office and others to say that they didn't. So the reason why I say that is because we really don't know unless we go through the bill in a predictable way. And if we don't do that in a predictable way, and if we shorten debate and we curve members off of that and don't give us an opportunity in the minority, that is what we have, Madam Chair, is the opportunity to raise these questions. We don't have the votes unless somebody changes their mind, but typically, we don't have necessarily the votes always to stop kind of what goes through if it looks like that's his pathway, but we do have the opportunity to raise these issues. So I do this in the most respectful way of saying if we can have this in a clear understanding of here's the, because we did do, you guys changed the structure, which was fine, but to have policy and finance in two different parts of the HHS, we're hearing the policy now, and you put one big bill together, and I was fine with having the, joint committee and put us all together. But in that, we are going to have to be able to really understand what are all of the policy provisions. It would be helpful to have that in front of us. I mean, I guess we could look at the bill while we're going through that so that it jogs our memories or jogs other memories of what we're doing, line that up with the things that are funded and not funded, the things that have fiscal implications or not, so that then we come out of there one way or the other, whatever decision we make, yay or nay, we actually know what that is. Senator, I've been in the room when we were in a majority party and making them putting these bills together, and often you are talking to each other, and it would be unintendable to bring everybody in the room in which to do it. That's not our custom, but now is the time for us to get together and to walk through this kind of piece by piece in a way that is organized so that we can figure this out.
Thank you, Senator Hayden. Duly noted. Senator Hoffman, one more comment?
Thank you, Madam Chair. I forgot one more. I wonder if somebody could help me understand when Kate Zacher-Pate got up and talked with Dr. Weiberg on the licensing board activities, there was a question that came to mind, is that the health boards have zero impact on the general fund, yet we're booking savings. I guess can somebody help me understand, if there's zero impact, why are we looking at some cuts, or are they not really cuts, like they're not on the formulary? I mean, how does that help? Because I'm having a hard time clarifying that comment, so help me understand.
Thank you, Senator Hoffman. Senator Abler?
Well, thank you, and
Or Mr. Albrecht can help.
go ahead, Mr. Albrecht. They need a different voice.
Well, Madam Chair, Senator Abler, and Senator Hoffman, I don't have a lot to offer because I just noticed that change this morning. There must be a revenue loss, I'm guessing, in the state government special revenue fund, but I haven't tracked it down. I do notice that the governor's number matches ours nearly identically, but I can't explain to you exactly what proposal is producing that result.
Thank
But
you.
I will.
Thank you, Mr. Albrecht. We'll get that information more further and just to mention, members, probably one of the best things we can do is let our staff go back to where they do a lot of this work in their offices, and I think the sooner they do that and get that information that you want, they can do that.
Madam Chair.
Senator Abler.
And, I'm in no hurry to leave. I'm happy to sit here and discuss everything, and if you, in terms of our half of the bill, and by the way, I just want to comment, the system that we had really worked well. From my point of view, we were able on our committee to go deep into DWRS and DTH and WIOA acronyms to just stimulate your mind and prevent Alzheimer's from getting onto us. We talked about focus on 5. How do you treat a child who's 2, and all the programs that could be joined there in Dakota County was helpful. And I think that was the point of having these 4 bills that we had as kind of placeholders. So we tried to create our bill out in front of the open. And so when you see what's in here from those, there should be no surprises. I think the other language in the bills, and it might be helpful to have a list of the bills that are in that are just, that might be a helpful thing for members. And to see what bills were included that were not related to the spreadsheet. But I think virtually from our part, with the exception of min choices, which we discussed at the end, which I worked on longer than you would think for how little product I had until just now, there was nothing that I can think of that was put in that was not heard in our committee and laid over or kept because it was just decided that it's going to go with us. And I think on the other half, there was some language that's of Senator Benson's project about the supplemental rates that came up late. And the insurance stuff, I think, was all in committee. So I don't think, compared to some bills, I remember in 2011, we were really pushed, and the delete all was full of things that people had not seen as much. I think that's not the case here. I think as people review when they get a chance to look it over, I think they'll find it to be things that have been heard with very small exceptions. And so it's curious that in the name of transparency, we've made it more complicated, but that was at least the things that are the hard things that are in depth were trying to be discussed out loud. So.
Thank you, Senator Abler. As I read through the bill as well, I saw many things that were parts of bills that we had heard in the committee. I heard a Senator Jensen or Klein, I'm not sure, I can't see.
Thank you, Madam Chair.
Okay, Senator Jensen. I couldn't see whose hand was up from the curve of the bench. I'm so sorry.
I appreciate all the comments made, and I appreciate the angst, because I think everybody in the room would like to be able to do more. But when I go back and I look at the biennium of 2014-15, we spent approximately $11.5 billion, and I look at the same sheet that I'm looking at today from 2016-17, and that year we spent $12.5 billion. So it was $11.5 billion, then $12.5 billion, and then this one is about $15 billion. So, you know, I know that I'm a freshman, I get that. But it's still, it's 11.5, 12.5, 15. And some of those, I'm sure, are due to tails and obligations that we have going forward. But we still are spending more and more money on health and human services. So I think that there's some value in being aware of that as well.
Thank you, Senator Jensen. Okay, Senator Laurie.
Madam Chair, you know, to Senator Jensen's point, and also to bring in some of what Senator Isaacson was saying earlier too, that's true. We are spending more and more money. The trouble with this bill is that we're using one-time shifts and gimmicks to cover it, and I mean, we really are, and pushing huge expenses out into the tails beyond our fiscal view that's available on this spreadsheet, and we didn't accommodate the $150 million across the 4 years that is known to be spent, and we're doing it within the context of, you know, a global budget that's proposing tax cuts. My fear is we're adopting a budget that is full of promises that we're not going to be able to keep, you know, collectively. Honestly, we've heard from a lot of folks here today who are, you know, pleased with the limited view that we have of the budget and some of the things that were able to be accomplished here, but it was accomplished with, you know, one-time money for ongoing needs in a way that really sets Minnesota up for fiscal disaster. And in a way, and it's odd that I'm sitting here being the fiscal conservative. I just need to call that out too. I'm just going, you know, come on, I'm supposed to be the tax and spend guy,
Well,
you know,
Senator
but
Laurie, we
all
should
of a
have you
sudden,
do this
here, I'm
more
calling
often.
you guys on spending in a way that is not responsible to our budget and our ongoing commitments. Whatever promises we make to these really important needs across the state of Minnesota, I want to be able to say, yeah, we have a structurally sound budget proposal, which is hard to do. I mean, believe me, I know. I have been putting them out for years. And it's important that somebody does that, and that's been the history and tradition, the role of the Minnesota Senate to put out, the fiscally responsible budget and go into committee with one that actually structurally works and makes sense and sets the state up for the set of proposals that we believe we're able to actually maintain. And I believe we're a long way from that in the budget that we have here. Some good things. We heard about a lot of them today. But I'm left with a great deal of nerves about the manner in which these things were paid for.
Thank you, Senator Laurie. Mr. Albrecht? We have some questions that I think you wanted to respond to.
Madam Chair and Senator Hoffman, I found the explanation for the reduced spending that you noticed on the statutory funds, the dedicated funds, line 13 on the front of the page spreadsheet. And it's related to the substance use disorder reform proposal, which begins on page 19. And if you go to page 20, you'll see that there is revenue going into the CD administration account. And that is the federal share of some payments to the state are being diverted into the CD fund. So with that, and then on line 678 is some spending in that same dedicated fund. So the net is the amount that the revenue exceeds the expenditures in a dedicated fund.
Thank you, Mr. Albrecht. Senator Hoffman?
Thank you, Madam Chair. And that's specifically relating to the board comment or the Title V dip into Mr. Albrecht.
Mr. Albrecht?
Madam Chair, Senator Hoffman, that issue that you asked about at the Department of Health, I don't know the answer to yet.
Okay. More information will be coming, Senator Hoffman. But at least you got your down payment. You got the down payment, so it's very good. Thank you, Mr. Albrecht. All right, members, so with that, seeing no further discussion, Senator Benson? Senator Abler?
Madam Chair.
Senator Hayden?
Madam Chair, I'm not sure, but I thought we were going to go through the policy provisions of the omnibus bill.
No, Senator Hayden, it is my understanding that the staff are not prepared with a comprehensive list, and so it would be posted as soon as they have it ready, and then it would be walked through in the committee tomorrow morning at 10, where you can answer questions. It'll be fully posted as soon as the staff have it ready.
Okay, all right. Well, thank you, Madam Chair.
Thank you, Madam
You're
Chair.
welcome, Senator Hayden. All right. So with that, Senator Benson, Senator Abler.
We've finished our committee's business for the day. We'll begin markup tomorrow morning.
Markup tomorrow morning. All right.
And Madam Chair,
Senator
Commissioner
Abler.
Piper could not come today, so she'll be there first thing as well, I understand. So
Okay, we'll make sure that
just
that
we can look
is
forward to
on.
that and then the rest. So thank you, members, for all your attention and for this process, and to all the public for all their engagement. It's good they're here.
Thank you, everybody. And with that, members, we are adjourned.
Thing where trigger one sentence.
And so if you're the person